afternoon. My name is Stephanie Parker. Welcome to the conference. My role here is to give you a little bit of insight on the roles and responsibilities of a public health nurse. A little bit of history about about my community. I am from the great city of Houston, Texas. We are in the midst of Harris County, which is home to 4.1 million people. We are the third most populous county in the United States. We are larger than 24 states. We are home to 25 Fortune 500 companies and greater than 3,000 energy-related firms, which makes us the energy capital of the world. We are also home to the Texas Medical Center, which is the largest medical center in the world, which employs 94,000 people. This is the highest density of patient care population, research, and basic science. While these staggering statistics could go on to describe the cultures, diversities, and ethnicities within our area, one can only imagine how difficult it may be for public health care workers to assess and protect our community from communicable diseases. The community health nurse and/or public health nurse plays a vital role in assessing and protecting our communities from infectious disease, communicable outbreaks, or just monitoring in the environment for at-risk populations. So if a public health nurse finds concerns or identifies trends in the community that are health concerns, they are required to report it to the CDC or their local Harris County healthcare officials. An example of a critical role that public health nurses played in suppressing the worldwide spread is of SARS, the Severe Acute Respiratory Syndrome. According to an article written in 2004 by the CDC for Public Health Guidance, SARS was discovered in Hong Kong in 2002. Per Hong Kong, they just viewed SARS as just a common cold or pneumonia. But the World Health Organization viewed this differently when this acute respiratory syndrome was spread to over 24 countries in 5 months. So SARS was reported by Hong Kong to the World Health Organization in February 2003. Areas with cases detected before the recommendations were issued, namely Vietnam, Hong Kong, Singapore, and Thailand, and over here in Toronto, experienced the largest and most severe outbreaks, all characterized by secondary chains of transmission outside of the healthcare facilities. So on March 12, 2003, the World Health Organization issued a historic global health alert for rapid spread from person to person in international travel. So this alert triggered an effort to end the spread of this virus through educating the public health care facilities and isolating infected individuals. So within 2 weeks of the health alert, public health care workers had identified an etiology and created pathways to isolate individuals and communities. Public health nurses, once they created pathways, went to leaders of healthcare organizations, of international travel organizations to identify and educate on the signs and symptoms of SARS and ways to isolate individuals. Due to the conscientious efforts of public health care workers and national health care organizations, this accelerated respiratory virus was brought to an end in July 2003 with over 8,000 reported cases and 780 deaths, 8 of which were U.S. citizens that had recently traveled outside of the United States. So this virus could easily affect our city and our community. With 4.2 million in population, Harris County is home to the world's largest medical center, 2 international airports. We are the 3rd largest port in the world. So these are all prime locations of in and out international travel, business, healthcare, and a virus like SARS could spread worldwide within a couple of days. So invisible at times, community health nurses play vital roles in public and community health initiatives that not only with public health scares and rapidly spreading communicable diseases, but it really takes an education and awareness of the environment and our awareness of the people around us, and the education and assessment of interventions of public health care workers. The government and the CDC have taken an active role in educating the public regarding infection control and community health awareness. But although as our population ages and increases, the only guarantee is that education and preventative interventions decrease acute health crisis in our communities. Thank you. Any questions?
How do healthcare officials identify and/or treat a patient with suspected SARS?
Well, identification is more of a malaise. It looks like a common cold, but you really have to identify with either chest x-ray, sputum culture, and once that sputum culture, it has to be tested to see if there's an RNA strain virus. But the most important thing while you are doing diagnostic testing is to isolate the individual for until all test results have returned.
How do I contact the appropriate health officials?
One could call the 1-800 number for the Center for Disease Control, which is 1-800-CDC-INFO, or your local Harris County Health and Human Services. Thank you, and I hope you enjoy the rest of your conference.